vessel is this? Lymphatic capillary and lymphatic network. Then lymphatic vessels, lymphatic nodes. Сейчас я lymphatic node. This lymphatic node, it has capsule. What the shape may be lymph nodes? Maybe millimeter of size, maybe even 5 centimeters, especially inguinal lymph nodes. Maybe singular and maybe numerous, especially on the intestinal lymph nodes, maybe until 400 lymph nodes. Nodi lymphatici intestinalis. Or 1, 2 maybe in popliteal fossa, 1, 2 in cubital fossa. Different number, visceral maybe lymph nodes, parietal lymph nodes, superficial, deep by localization. And different size and different shape, oval, segmental, lenticular, ellipsoid and so on. And it has convex and concave part. To the convex part comes vasa lymphatica afferens, and efferent vessels leave the hilum of the lymphatic node, through which lymphatic artery and lymphatic vein also pass, and nerves which supply the lymph node. Yes? And through the lymphatic vessels, afferent vessels, lymph flow under the capsule into the subcapsular lymphatic sinus. Under the capsule we have sinus subcapsularis. The parenchyma, and from the capsule goes trabecular, yes? Trabecular. And divides the parenchyma into the cortex and medulla. Cortex and medulla. And cortex consists of these lymphoid nodes, nodules, noduli, lymphoidae. Lymphoid, not lymphatic, it is lymphoid nodule with the centers of differentiation of the cells, germinative centers. In the centers are formed new lymphocytes, lymphoblasts are formed. New cells are formed in this germinative center, center of differentiation of lymphoid nodules, and intercortical and paracortical zone. It is considered the zone of accumulation of T lymphocytes, thymus-dependent lymphocytes. And medulla is considered site of localization of B lymphocytes. T lymphocytes, different type, yes, of T cells. We have helpers, killers, suppressors, regulators, and they participate in phagocytosis, in the cellular immunological reaction. B lymphocytes mainly participate in production of immunoglobulin and antibodies, yes, immunoglobulin, which participate in humoral reaction of immunological humoral reactions, antigen, antibody reaction, B lymphocytes, T lymphocytes. And lymph flows through the subcapsular sinus, then cortical sinus, then medullary sinus, then sinus of the hilum, and outflow through vasa efferentia. What structure has this sinus? Inside the sinus we have like this. It is narrow split-like space, like vessel space. So sinus is wide, more wide than capillary. It is space in which we have reticular tissue. Between of this network tissue we have TB lymphocytes which pass through the TB zone, pass inside the sinus, and they find this agent and phagocytose or kill them. When this fluid flows from this zone, come into the fluid, these TB lymphocytes, and clean this from products of inflammation, from microbial, all died cells from, in all organs we have died cells, tumor cells, and more clean lymph from lymph node, one lymph node to other, it is not cleaned in one lymph node. From one to other, like filter of water. goes and filtrated. You understand? As filtration, function of filtration, biological filter of lymph nodes. But it is organ of immune system because here we have reservation of T-B cells. Yes, reserve immune lymphoid cells, defense system cells. This lymph node. Next, after, once more remind me, parts of the lymphatic system consist of what first? Capillaries, next. Vessels, their structure, their function. Their structure, their function. Structure, anatomy and physiology, they are intimately connected. If it has this structure, it has corresponding this function. Capillary. Vessel have this structure, corresponding this function, transport function. Then lymph nodes has this structure, it has biological filter and immunological barrier function. Next part, lymphatic trunks. Lymphatic vessels join and form all large lymphatic trunks. We have different region trunks. Before explanation of these trunks, I will explain regional group of lymph nodes. We have lumbar trunks, intestinal trunk, bronchomediastinal trunk, from the head and neck, jugular trunk, from upper leg, subclavian trunk. And this trunk join and form ducts. We have left lymphatic duct and right lymphatic. Right is small, non-permanent, short, about 1-2 centimeters. Together with jugular right and subclavian right, drain into the right venous angle. But left lymphatic duct, it is called thoracic duct, ductus thoracicus, which is long, much longer, from 20 to 41 centimeters, draining into the left venous angle, together with left jugular and left subclavian. And before explanation of this ducts and trunks, we'll describe lymph nodes of different regions. They are called regional lymph nodes. When you will prepare this lymphatic system, please from textbook or atlas, copyright region, head, lymph nodes, neck, lymph nodes, upper limb, lymph nodes, regional group of lymph nodes. We'll start from lower extremity. What group of lymph nodes here we have? Popliteal and inguinal. Two large groups, popliteal and popliteal fossa behind, and inguinal. By localization, they may be superficial and deep. Superficial from superficial skin, subcutaneous fascia, inflammation comes to this lymph. Lymph is outflow into the superficial inguinal. Where are they located? On fascia lata femoris, superficial lamina of fascia lata near hiatus saphenus. Fascia cribrosa covers in this region under the inguinal ligament. We have medial group of the vessels from the big toes along the medial side. Lymph is outflow into the inguinal group, but from the lateral, the digitus, the small toes. From the lateral side, at first is outflow into the popliteal region, and then from popliteal is outflow to the inguinal. This we have medial and lateral, intermedial group of lymphatic vessels and two group of lymphatic nodes. This inguinal superficial receives from the superficial structures, from the joints, deep muscles, bones, ligament. Is outflow into the deep inguinal lymph nodes, which are located under the inguinal ligament, near the vessels. The superficial deep near the femoral vessels, superficial and deep. Lacuna vasorum near arteria vena femoralis. Arteria vena femoralis. Is lymph nodes. Superficial, but not only from the lower extremity receive this, also from what organs receive inguinal lymph nodes? External genitalia. Remember, if female Bartholinitis, glandula vesicularis major, inflammation, where lymph nodes becomes painful, inguinal region. After injection in gluteal region, maybe develop abscess, inflammation. gluteal region injection, where lymph nodes become increased in size and painful, also inguinal region. Inferior part of abdomen, also lymph is outflow. That's from the lower limbs, external genitalia, inferior part of abdominal wall and gluteal region, lymph is outflow into this group of lymph nodes. If you will find here, here we have about 10-15 lymph nodes, increased size and painful lymph nodes here, you must find inflammation where you have. Because all these lymph nodes increase, they are very, lymphatic system is very important in clinic. They help for diagnosis. Because in all inflammation, they becomes painful and increased in size and help you for diagnosis. Then from here, from the lower extremities, lower limbs, lymph is outflow, vasa afferentia bring, vasa efferentia continues into what group of lymph nodes? Pelvic group. Next, you will give topic. Pelvic group lymph nodes. Here we have parietal and visceral. In all cavities we have parietal and visceral vessels and nodes. Parietal are located along the vessels. Common iliac, external iliac and internal iliac. We have vasa iliaca externa, interna and communis. Along these vessels we have parietal group of lymph nodes. And visceral group, can you name visceral group? What organs? Lesser pelvic cavity we have. Organs of lesser pelvic cavity. No? Uterus, urinary bladder, rectum, prostata, testes. Just now we have finished this urogenital. That is why visceral lymph nodes will called in accordance name of this organ. What group of visceral lymph nodes? Name. Come. Uterine lymph nodes, rectal lymph nodes, the prostatic lymph nodes, they are visceral, and this iliac are parietal. From here, lymph is outflow, you can see, into what group? Into the lumbar group of lymph nodes. In abdominal cavity, along the abdominal aorta and vena cava inferior, here we have the large group of lymph nodes. They form the left group and right group of lymph nodes, abdominal lymph nodes. Nodi lymphatici lumbalis. Nodi lymphatici lumbalis. Right and left. They are divided into groups. Pre-aortic, lateral aortic, retroaortic. Pre-caval, lateral caval, retrocaval. And between them, intermediate position have lymph nodes. Nodi lymphatici lumbalis, they collect lymph from lower extremities, from the pelvic region, and from all organs and walls of abdominal region. The greatest group of lymph nodes, nodi lymphatici lumbalis. What groups we have? Left aortic group and right caval group. In front, lateral side, behind, and between them. Nodi lymphatici lumbalis. And intestinal group, the largest group of lymph nodes, which are located in the mesocolon, mesenterium. About 400 lymph nodes. Can you imagine in cancer, tumor, malignization of this intestine, for example, cancer of the rectum, or colon. All these lymph nodes become increased, painful, and they so increased in size that can obstruct it lumen of intestine. Yeah? And operation in this case is not possible, no, is not effective. And from intestine also is outflow into the lumbar group of lymph nodes. Turn your attention from ovary also, because ovary testes, they are developing the lumbar region, yes, and gradually descend. They receive vessels and lymph outflow also take into the lumbar group of lymph nodes. After this group of lymph nodes, lumbar group of lymph nodes, are formed two trunks. They are called truncus lumbalis. dexter et sinister. Truncus lumbalis, dexter et sinister. What name they have this group lymph nodes? Lumbar group of lymph nodes, yes? And from this starts two trunks. Efferent vessels, after lymphatic vessels, after lymph nodes, we have trunks, yes? What trunks? Truncus lumbalis dexter and truncus lumbalis sinister. Two trunks joined together and form cisterna chyli. Cisterna chyli, it is initial part of thoracic duct. In abdominal cavity we have enlargement. Chyli, it is milky cistern. Milky cistern, cisterna chyli. Because in 25% cases, into this origin of ductus thoracicus also drains truncus intestinalis, which is a white color, and brings this fat with lymph into the truncus lumbalis. That's two truncus lumbalis, dexter, sinister, and truncus intestinalis gives rise to cisterna chyli and gives rise to thoracic duct on level of the second lumbar until 12 thoracic extends this cisterna chyli. You will start below to upward, not from 12 to second, from second to 12, because it goes from lower upward. And then pass through the hiatus aorticus of diaphragm, together with aorta, through the diaphragm, and goes in posterior mediastinum in thoracic cavity, behind aorta, between esophagus and vena azicus, in front of the vertebral column, on the right side of the vertebral bodies. On the 6-7 vertebra, it turns to the left, inclined to the left side, goes behind the esophagus, and then leaves the thoracic cavity through the superior apertura and forms arcus in cervical part. It forms arch, arcus ductus thoracicus. That's what portions it has: abdominal, thoracic, and cervical. 3 portions of thoracic duct, and it is drained here. Venous angles, you can see the right and left. It drains after arcus. It drained into the left venous angle, and this thoracic duct and venous angle also, they have valve which regulated only one direction but not opposite. Venous blood could not pass inside the lymphatic vessel. The valve is open inside the venous angle, and inside the vein also. Here pressure of the venous angle is very low pressure we have in this region. It about 0. That is why from through the thoracic duct, lymph is outflow into the venous angle, together with what trunks? Together with subclavian and jugular trunk. From the right half is drained truncus jugularis dexter, about 2 centimeters, short, not permanent, maybe absent. Right? Lymphatic duct. The thoracic duct, initial part, adjoins to the right crus of diaphragm. That is why on contraction of the diaphragm, this initial part enlarged and lymph is outflow, helps. Like diaphragm, like for the thoracic duct, serves as passive heart. It is called passive heart or thoracic duct. Also help. During lecture you must written factors which helps to outflow of the lymph. What factors helps for flow of the lymph? One is valve in one direction. Next is diaphragm contraction, helps. Next is low pressure of here. Next is negative pressure in pleural cavity. What factors help for? Because the lymph from lower part goes opposite to the gravicity. Yes, very difficult conditions for flowing. What factors help? Pressure in the junction of these veins is very low, about 0 millimeters. That is why from high pressure it flows to the site of the low pressure. The valvular apparatus helps to flow of the lymph in one direction, from lower part to forward direction. Contraction of the muscles and fascia, especially in all part, contraction of the muscles, the muscular walk helps for lymph flow. For the very long time passive in bed, patient without active work, then maybe develop lymphostase. Muscular walk and fascia muscles help for lymph flow. For the thoracic duct, especially diaphragm, safe as passive heart. Contraction of the diaphragm, which adjoins with the thoracic duct, helps for lymph flow. Она в кабинете у себя. And lymph flows in this direction. Pulsation of the vessels and also negative pressure in thoracic cavity also helps. This is from lower part comes to thoracic duct, then from upper limb. Next picture. From all intestinal, from abdominal organs, stomach, liver, gallbladder, into what group come? Into the lumbar group of lymph nodes. Next region, thorax, thoracic cavity. Lymph nodes of the thoracic cavity, they are also in cavities, all vessels, nodes, divided in what part? Visceral, and parietal. In thoracic cavity, we also have parietal, intercostal, parasternal, paravertebral, parietal, superior diaphragmatic, and we have visceral. Near the organs, for example, we have pulmonary lymph nodes, bronchopulmonary near the hilum of the lung, inferior tracheobronchial or bifurcation lymph nodes, superior tracheobronchial, paratracheal lymph nodes, paraesophageal lymph nodes, and so on the lymph nodes of the anterior, middle, and posterior mediastinum, near the organs which are located in thoracic cavity, lungs, bronchi, trachea, esophagus. We have visceral group of lymph nodes, and from all these lymph afferent lymph nodes and vasa efferents is formed truncus bronchomediastinalis. It is not marked here. On right side, truncus bronchomediastinalis is drained into the ductus lymphaticus dexter. On left side, into the ductus thoracicus. When ductus thoracicus passes through thoracic cavity, from left half, organs and walls, lymph is outflow through the truncus bronchomediastinalis into the thoracic duct. From left part, truncus bronchomediastinalis. From right half, truncus bronchomediastinalis dexter, sinister. On this side, drains into the ductus lymphaticus dexter. On this side, into the ductus thoracicus, drain. From the region of the upper limb, and then head and neck. From upper limb, we have two groups of lymph nodes, the cubital, 1, 2, and axillary. And lymphatic vessels divided into the lateral, medial, and intermediary group of в кабинете. Вы не проходили что-то? Когда вместе с вами.